So I don't know, Jack, if you wanted to go into the example just
Do
leading
you want me
from
to do that
brand.
example?
Yeah,
Yeah,
maybe we'll do that first. While Jack's
sure.
just getting this up, one of the things that we were just talking about in the break is it's just really nice to hear the feedback back from different configurations and implementations. And really, what we want to make sure is that what we are configuring into the system makes it super easy for caseworkers and case managers. We want to keep it streamlined and effective, and that's something that we're doing the thinking about on the Primero team to make those efficiencies. I'll hand back over to Jack.
Yeah, sure. So I just thought of this on the fly because I was listening to Brandon's presentation and the lessons learned from that implementation. And one of the things he said was that, for certain users, the workflow for follow-ups was not very obvious, right? People just sort of wanted to go list the follow-up they'd already done rather than going ahead and planning one out. And this is something that I have noticed, like I said, as I've been doing a lot of configuration work. I've been looking at our default forms. So this is a screenshot from the default interagency forms. If I go to create a follow-up, I have this field that sets a due date to create a task. And something good that we've done here is we've added help text that says, this will create a reminder in the task list. The problem is so much of the other stuff that is related to planning a follow-up, you don't even see it yet because it's further down in this form, right? So before I even get to say what type of follow-up I'm planning out, I already have this field here that says, okay, well, what day did you do the follow-up? So I'm never actually giving the user an opportunity to plan out that follow-up. So this is something when I'm doing form configuration now, I'll try to rearrange these. I'll try to add headers that explain this portion up top is for planning the follow-ups and for creating your tasks. And then this section down here is for actually implementing that follow-up. And sometimes I'll even put a little checkbox in there that hides the rest of the form unless you say, yes, I am implementing this follow-up right now. Um, it's all stuff that you can do pretty much through the admin UI, through the form editor. And so, this is the kind of stuff that maybe we can step in and provide some guidance on. I'll stop sharing and you can take over, Jan.
Yeah. So this next session is meant to be interactive. So we're bringing you back to your roots, back to training when you're sitting with different caseworkers and you're starting to implement your system. We wanted to walk through a case study. So I'll just go back to sharing my screen. But before I share my screen, I'm just gonna pop a link in the chat. This will be what you're going to complete as you're looking at this case study. So in this case, we're pretending we have a configured system. It's up and running and live, and you're training a caseworker. And so you have Amina. She's 10 years old. She was referred to a child protection office by her school teacher after noticing signs of abuse. During the interview, which was on November 14th, 2025, in Metro City and far away, that's the country, the caseworker observed that Amina had bruises. Based on the assessment, Amina met the criteria for case management for abuse and denial of services, and she needs medical services and to further investigate by the proper authorities. So she's going to be contacted through her child protection office, and her officer is named Jana, and her number is there up on the screen. So with this key information that you're seeing, I'd like you all to click on the link that I've put in the chat, and I'm hoping it works for everyone. And I would like you to fill out that form. This is your Primero simulated form that you need to fill out for this assessment. And I'll give everyone a few minutes to get into the link, and we'll keep this up so you can fill out those 4, 5, or 6 questions that you have there. And if you have any questions, please pop them in the chat and I'll ask my my team to answer any questions as they come in, and let me know because I can't see the chat. So as you're filling out the form, you can just highlight, you'll be just entering in the information that's highlighted here in yellow, just to try to make it really clear. I'm just going to switch to the results to see how many people have submitted. Got one response so far, so I'm hoping that more people will complete this activity. Got 2 responses, great. Come back to this slide so you can keep filling out the form in the chat based on this information. All right, we got 6 responses, 7. Refresh my screen. It's taking around 2 minutes per person, which is great to see. I'm going to wait for another minute and then we'll get into the results. Okay, we got 10 responses. So before we get into the responses, for those of you who haven't had a chance to fill this out, so the way the form looks is you have the date of interview, which was provided in the case study, the country, the city, which has some options. What's her favorite food, which is mandatory. What services does the child need? How do we contact the child? What are her vulnerabilities or protection concerns? And the date the child is not available to be contacted. So without getting into the results, I will just see if anybody wants to put up their hand and give me some feedback on my constructed form. We'll stop.
You there, Jan? Did you freeze?
Yeah, she's frozen for me too.
Or she's very still. That's not Jan's style. I think we lost Jan. Briefly.
Well, I see Ali's hands up. So if you want to provide some feedback while we're waiting for Jan to come back.
Yes, I can. Thanks, Jack and Jan. So the things that I've noticed, and by the way, I also teach UX in the university. So the date for the first field, the date of interview is free text. Well, while it should be like date. Input type, country doesn't have like a drop down. City of interview should have been like more of a search, like enable you to search for that city, because when you have lots of cities, just like in most countries, it would be harder to navigate through all of the radio buttons. What is the child's favorite food is mandatory, and for case management, that's not always the case. What services does the child need? Services also usually are drop downs. How do you contact the child? A phone number, maybe a number in type input here, and is the child vulnerable? Protection. The protection concerns are usually multiple selections, and the date that the child is not available. My concern is actually about this, the question itself rather than input type. Yeah.
Yeah. And I see Lama called out specifically that multi-select issue with the protection issues. And then yeah, I see Robert's question about how well you're able to report on this data. So, I can give some insight into, how we designed this form, because Jan and I were discussing it before we did this presentation. Obviously, she's restarting Teams, by the way. Yeah, so these are all very obvious problems. This is all very deliberate. And in fact, the required field about favorite type of food, we were debating what sort of ridiculous question we could make required, and that was what we came up with. To Robert's point, you can't report on a lot of this data because, for instance, the date field is pre-response. You're not actually going to be able to include that in a report. Let me see. What else? There was another one in here that I remember was really badly formatted. The types of services. Not only should it be a multi-select, but it's pre-response right now. And so if I'm typing out medical, I can spell that different ways. I might say health services instead of medical. There's a lot of different ways that this can play out, and the data is going to be very, very inconsistent. Let me see if anybody else had any other feedback. Yeah, vulnerability should include other as an option. Yep, and that's another one. The country is, I believe, free response here. So this is a pretty, I think we can all agree this is a pretty terrible form, right?
And I'm back, Jack, too. Sorry about that.
Yeah, no problem.
Great. I came in when everyone was saying it's terrible, and that's exactly what we wanted to talk about. Robert, please go ahead.
As we're doing this, I think I would like people to be thinking about the taxonomy of a bad form, the categories that we're talking about. So we've heard some issues, right? But we should be able to identify the categories that we're talking about. So Samia said about how limited it is. Lama said about the data type, the field type should be multi-select. You should be able to pick more than one thing, right? There are a finite number of these categories. And I think if we wanted to build like a model for healthy configuration, we could categorize these problem areas almost into sort of like a checklist. It's just a thought.
That's a good point. There is also one, Jan, do you mind if I call out one other thing?
Go for it.
So, Ali, I heard you call this out, and this was the most interesting one to me because you called it out, but you couldn't really, you were like, this, I forget what exactly you said, but you said something like, this seems kind of weird, or I don't know what to do with this, which is that last question, that date field. The date the child is not available to be contacted. One, it's confusing because it's we're stating it as a negative, is not available to be contacted, right? That's immediately confusing. But the second thing, and the reason I'm calling this out, is because it's completely and totally irrelevant to the information that's been given to us, right? Like, we don't know this information. It doesn't seem like this is something we're going to be filling out all the time. And I think we've watched this happen with a number of Primero implementations where there will be extremely long forms with a lot of information. And it's really good if you have that quality and that breadth of information. But it's extremely confusing to look at, and nobody ever actually fills it all out. So I guess maybe the rule there is less is more. I don't know if you have kind of any qualifications to that, Jan, but
Yeah, no, I think that's exactly it. Like one of the things I've noticed in the old and the new interagency CPIMS plus forms is, of course, on the paper forms, you have your case ID at the top of every paper form, as well as the case code or caseworker name or something that is repeated to identify that specific paper page. We have seen implementations who have put that on every single form. And how necessary is it for a caseworker to have to re-enter that specific information multiple times? And so one of the biggest things that we are trying to do is to address these types of issues. I just want to actually share my screen to show you also what's coming out in those 15 responses. So one of the first question was the date of interview. We got just like November, these different spellings of 14th, different ways of putting in the date, day, year, month, year, day. And so one of the things that we want to make sure is that there's consistency when we're bringing in date information. Same with country of interview, should be a drop down. I'm sure you guys spoke about this while I was frozen. Apologies about that. City of interview, if it's not listed, maybe we need to get that information because it's really important. What's their favorite food? Just as exactly like Jack said, it's not really relevant and it's mandatory. Why is that? And so as you go through these questions, as you are going through your configuration, it's really thinking about how is this going to be applied, and how is this useful? And that brings me into my next point, which is going to be about how we link how this all links back to quality outcomes. And so when a caseworker is struggling to fill out all this information, they're already busy and we want to keep it tight and concise. And this will help with their own decision making. When they're making follow-up appointments, when they're doing service provision, it's way quicker if they know exactly what they need to look at, and that'll help them enhance their action and the time that it takes to action anything that they have. The second thing is admin burden. We do not want caseworkers who are just like, oh, I have to log into Primero again because I have to fill out all of these forms, and oh, sometimes my forms may not be available in the app, and so it's on paper. And we want to work with you in making sure that the system is streamlined enough that it doesn't continue to add to the admin burnout. And this also helps in reporting. The system will be able to aggregate and anonymize information. We have different KPIs and insights and reporting features, and people are doing Power BI integrations, and the data is only as good as what you put in. And that's what we want to really help you in doing in the next year, is cleaning up your configurations and making sure that we're able to reduce the admin burden. We want to have consistent data entry support, supporting evaluation and evidence-based policy resource allocation. So what I mean by this is somebody mentioned this in yesterday's sessions, and I can't remember who it was, but everyone may have different data reporting structures. Some people have different reports based on their organization. And so when we're doing a setup, we want to make sure that we're doing data structures that appease all of the different agencies that are a part of your implementation, so that it'll help them in their evidence-based outcomes and their reporting for their organizations. And that's something that we really want to also be able to do back on the UNICEF side is, this feeds into our global reports, and we want to make sure that it is clear. But also, with that said, everyone is dealing right now with this financial crisis, and we want to make sure that we can show how resource allocation should be applied to improve outcomes, and this is the best way to do it. The other things that help with UX and quality outcomes and using a system like this is coordination. As we know, you don't have to find different ways of coordinating and communicating with different service providers nationally. And this is a tool that can help and centralize that. And on our side, we are going to continually help and improve our usability, whether it's offline, because I know lots of you are working in areas where there may be limited internet connectivity, or continuous improvement for people who have limited digital literacy. I know some places we have some caseworkers, they come in and they're just like hotshots on their phone, and it's so easy for them to enter information. But then there are certain places where this is maybe the first time they're really getting comfortable with a smartphone or a laptop. And we really want to make sure that they're not uncomfortable and not looking forward to using the system because it's just not easy to use. So this is just a few of the things that I wanted to highlight. But based on all of the feedback that you've given me now on the last form, we're going to do the same case study again. And I'm going to ask you to fill out this new form. So I'm going to put a new form in the chat and reshare my screen. And hopefully this time Teams doesn't freeze on me. And we'll give you a few minutes to just check out this new form and tell me what you think. And if you can complete it, that would be great. So it's all the same information. Sorry, I'm just going to say that. It's all the same information from the first case study. It's just a new form that you're filling out. So I'm just going to switch back to my other screen just to see where we're at in terms of the number of responses. All right, we're just at 3 responses. So I'm at 4 now, so I'll give another couple minutes for you to fill out this case study. All right, we're at 8. It looks like some are coming in through the bad one. It's got 17 on the other, and I got 9 on the new one. So I'm gonna actually just keep us going to keep us on time. So what you're seeing is, I hope, a drastic difference in the type of data that you're getting. The first question is your date of interview. So now you're getting a standardized date of interview. Most people are saying the right information, that it's November 14th was her interview based on the case study, which is great. So of course there's going to be some minor user error because I'm seeing some 13th come out, but that's great. At least it's all coming out in the same format, and we can pull this out and visualize it in reports. We can create a lot more tasks and follow-ups based on these dates in the way that it's entered. The next thing is we have here the location of the interview, which not only has the city, but it has the country as well. So it takes away one less step for the caseworker to not have to enter two different fields. And it's a drop down. We can just select it. And if it's not listed, because it wasn't listed, you will be able to enter in the location, since it's very important information. You have now information on the services. So what types of services that she needs. And if it wasn't listed, you have a drop down, a multi-select of protection concerns. So we talked about how she has denial of services and abuse. It's not a single select, so it's meeting the needs of what she requires for her assessment. You have also a multi-select of services, so everyone is correctly entering in exactly what she needs, as well as some investigation, which is great. And I really appreciate everyone adding in their thoughts on what else she needs. Counseling services, psychosocial, I don't know who put in pasta, but yeah, it's great. And then how do you contact the child? It's not when is she not able to be contacted in this weird double negative. It's who is she contacted through and how do I contact that person? It's one spot that if I was a manager or if I was a caseworker, I would go directly to this form and I'm quickly able to find this information. And so I just wanted to pause there to see if there's any other things that people would like to highlight, even in your configurations or feedback that you'd want to share for others. Just take a minute to stop sharing. Okay.
Yeah, it's
I
a
So-
good point.
I wanted
sorry.
to make a point, two points on this whole user experience conversation, because I think as a product owner, which is my role, is trying to like make good decisions about what we invest in as a product. We often have very demanding conversations with very demanding partners, governments, etc., about all the features that we need to build for Primero. You know, it needs this, it needs that. These are software development enterprises that take months and lots of testing, and they're very difficult to implement, and very sophisticated tools. But with configurations, the basic building block, nobody pays any attention, and people will introduce all sorts of terrible ideas into the configuration. So it doesn't really matter if you have AI or if you have great sort of features in the app. If the forms themselves are terrible, the data will be terrible. If the forms themselves are painful to complete, people won't put good data into them and your data quality will suffer. If the forms are not clear and intuitive, maybe there's a very important piece of information and people don't know where it belongs. Does it belong in this field or in this field or in this form or in that form? And this is the most common problem that we have. The most common problem is big ideas that turn into big unmanageable configurations that don't have a proper intuitive flow. They aren't helping the user to understand them. They're another constraint. They're an obstacle to using the system properly. And that's why I didn't mean to make a joke out of your exercise, but if you give people the opportunity to put some completely irrelevant thing into your data set, you will find that in your data set. And when you try to go to report on it, suddenly you have pasta there. And that's a real problem that we face. So I'm excited to see in the coming year a real effort to look at the existing configurations that we have, test them, understand them, see what parts are being used and what parts aren't being used. If there are forms with 25 fields on them, I guarantee you there are 5 or 6 fields on that form that nobody ever fills out. And to take another careful look at the decisions that we make when we're making changes to configurations and introducing new configurations.
Jack, did you want to go ahead? Anything else?
I mean, I think the final slide was basically just reviewing that form. So that's about it. I guess the only thing I would say is that, again, some of the changes that are going to be really important for UI are going to be things that are a little bit difficult to change through the admin UI. And this is where we come in, or G comes in, or Josian comes in and make some changes. But we want to focus on the stuff that's the easiest thing for you to change. And forms are a really good example of that.
Exactly. And one of the things that I've been reaching out, and as well as the regional teams have been reaching out to you all, is making sure, so led by Suzanne, I don't know if she's on the call, but I want to give a shout out to her and the Save the Children colleagues for the CPIMS Plus module, as well as Elfrida and Megan and the GBV team for the GBV IMS Plus module. We've done a lot of development on this new feature called Insights, KPIs, where you're able to visualize the information from your cases and have them in either a CPIMS or a GBV IMS dashboard for your own monitoring mechanisms. And so this is another thing that we're going to be coming back to, is making sure your configurations link back to these various core features that we're developing to make your programs easier. And so this kind of brings me to my last slide, is let's actually talk about Primero. We want to get your feedback. I know I see a lot of the names on the call that I talk to pretty regularly, like Dion and Lama and others that just give me feedback. And I think one of the things is we love hearing feedback from you, because that's how we define our roadmap. Anytime you come back to us about things that'll improve your program, that is how we define what we change in the system in the next year, and how we line up our vendor contracts. And that's exciting for us to be able to meet those needs. So what I'd like you to do is, in the chat, there's another survey, and we'd love to see how we can improve our user experience next year, and would love your feedback directly into that form, so we can have a look and we can chat through that and make sure that your inputs are prioritized next year, because that really is how we work, and we really appreciate all of your feedback continually. So with that said, if there are no other comments or questions, and if you have any feedback, just pop them in the chat. I am going to hand over to my colleague Simone. He is going to be leading us through on integrations, how we are doing connected systems, and we're going to have a couple speakers. So over to you, Simone.
Hello, everyone. So we're almost toward the end, and we're moving now to talk about integration. How Primero can connect with other systems, and how can we make it easier for people to get information into the platform using other systems. So through this session, we will be introduced to two approaches. The first one is a QR-based system that will let people without Primero logins submit information. So imagine, for example, you have a beneficiary or a caseworker who meets a beneficiary. He raises some concerns. There is a QR code. They can scan this QR code, fill out a form, and this form will automatically goes into the case file or into Primero in the corresponding place. So this is the first one. The second is about integrating with other systems that are maybe more robust in specialized or with special features, like for example, the chatbot of Rapid Pro, and how this basically automate routine interactions and reduce the application of work. So we will dive into this, and we want to hear about, and then at the end, we want to hear from you about the routine tasks that create redundancy in your work. What are the gaps? What can automation help within Primero to help you within this work? And we need so far, therefore, your real world insight to shape basically what we need to build into Primero. So we will move back at the end towards our whiteboard and basically put these inputs in there for our next week, our next year work. And for this session, I'm welcoming our speaker, Robert. So Robert Maktab is a child protection specialist at UNICEF. He's a child rights advocate and a technology for development expert. So joining two words into one. And he's basically the reason we are all here today. He's the father of Primero. And the work he has done, the vision he's had for using technology to protect children. That's why this platform today exists. And that's why basically we are meeting today. So in few words, welcome, Robert. And thank you also for your leadership on this.
Oh, you've made me blush. I didn't ask you to do that. You were just supposed to introduce the session. Anyways,
No, I
it's
was
nice.
also supposed to introduce you.
Yeah, okay. I think you read my LinkedIn profile there. Anyways,
I
you all know
did,
who I
yes.
am.
I did. I mean,
Well, I would only say that to that introduction, I must respond that, you know, I've dedicated a lot of time and love to this, but it doesn't happen in isolation. We have an enormous and a very, very impressive um, community and group of people associated with this, not just the team with at UNICEF in the global or in the regional offices, but all of you, all of the steering committees, the interagency forum where we work. I mean, none of this would happen without all of that support and energy and knowledge and capacity. And I always like to come back to this very, very important detail. It's like there were systems in place before Primero. Primero is built on top of the experience and the capacity and the expertise of people that were involved in this long before I was. So as much as I appreciate the introduction and, you know, I've definitely poured my heart into this, it doesn't happen in isolation and everybody, you know, everybody contributes. So, but thank you. And with that, I'm going to jump into my presentation. So if you've been following the trajectory of this work over the last several years, you've heard us talk a lot about interoperability. And what we've learned over the last few years is that this is a very challenging area of our work because it makes a lot of sense. There are very few people that work in child protection or gender-based violence or protection broadly who don't have as a part of their almost day-to-day responsibilities interactions with other sectors, interactions with other partners. That is what case management really is about, is there's transactions between you know, different actors that are providing different services to create a type of protection and a type of response that no individual or single organization can deliver on. So this is a part of our ways of working that date back, you know, decades, and this is how we've all been trained and understand the work. But then when we want to translate that into systems that speak with each other, it's not so easy, even though that logic is very clear, right? Even though we can all imagine how that would add value, that, you know, the same child should not have to be registered multiple times to receive different services that they need, right? The same mother should not have to bring their child to various different places to get services that could be integrated and provided in a streamlined way. And I always use the example personally of when I go to a hospital with my children and I watch, because we have the good fortune of having good health care, I watch and I see these are very, very different disciplines that we're engaging with. You're engaging with somebody at a registration desk. You may be engaging with a nursing station. There may be an imaging or an X-ray involved. There's specialists involved. And these are all very, very different disciplines. But somehow they're connected to each other, even though, you know, they work in a different part of the hospital, they work in a different part of the health system. And that's been a part of the inspiration for really trying to unpack and unlock the potential of integration for the work that we do. But that said, we haven't made very much progress, and we've been working on it very hard for years. Jan is probably I think, among the most experienced people in all of UNICEF globally. That's 17,000 people in developing, designing, and supporting integrations of systems. And this is something that we've been talking about for at least 5 years and working actively on at least 5 years. And we have a lot of lessons learned, but the truth is that we aren't making the kind of progress that I would have expected. You know, we're now at the end of 2025. We're officially living in the future. And most of the places that we work, we still struggle to see, you know, how we can actually operationalize interoperability and automation. Integrations. Now, we're still struggling, for example, I saw on the whiteboard, we're still struggling for a seamless integration between CPIMS and GBBIMS, which are modules on the same platform. So there's a whole lot to unpack here. It's not a straightforward, easy part of our work, but I think it's incumbent upon us to lead by example and to show how this can add value, not only for, you know, in the operational sense of operational efficiencies, et cetera, security, all of those good things, but in terms of the real lived experience of the individuals and the communities that we're serving. Okay, so that's my introduction to the subject matter. I'm gonna share some slides, and then we're gonna play with some toys. And we left this deliberately for the latter part of the day because I hope that you'll enjoy getting access to these things and really contemplating how they could become useful for us. So let me just share my screen. Hope I can do this without making a mess of it. And please let me know when you see the deck, Jan, if you wouldn't mind just telling me when you see that. Okay, so I was creating the slide and I thought, am I really going to use this title again? I think I've used the title, "The Future is Integrated," at least 5 or 6 years in a row now. Like, if we haven't, if you're not getting bored of this one yet, I'm surprised. But we're looking at a picture of an adolescent girl. She's using an iPad. She's got Bluetooth headset on. I guarantee you that that device that she's using has just right in front of her eyes right now at least 5, if not a dozen integrations. There's a Bluetooth integration. There's probably a login integration. There's the ability for us to, you know, put the content that we have in one type of file into another type of system. These are all examples of integration. These are all examples of things that we currently don't have in our own systems. And the people that we work with work really hard, and they have a lot of work to do. And as I've explained in the past, burnout in the social services sector is largely associated with paperwork and the burdens of documentation. So the objective of the session here is to understand a little bit what we've learned, right, about the steps and the work that are required to make integrations viable, because we shouldn't be just doing them for their own sake. You know, this is definitely a lesson learned. The second point, objective here, is that sharing some examples of successful integrations. And I say successful, meaning that we were successfully able to implement them, right? But how successful, how much value they added is up for debate. And I added in the end of this one that I didn't originally include automations, because we want to have very clear understanding of what we're talking about here. We have the word interoperability, the word integration, and we're also talking about automation. So I want to talk a little bit about that. And then to explore some ideas, and this is a very important term for everybody to understand what a use case is. A use case is just our way of presenting a set of problems or needs that are currently unmet and our approach to meeting or addressing that problem. So let's take this on. I'll try to not spend too much time on the slides so we can play around with the toys. So a few things that we talk about when we talk about integrations, about solving a problem. I was in Tajikistan recently, a few weeks ago, and this one always comes up when we're engaging with a government partner. We're not the only ones they're talking to, right? child protection is a pretty niche sector. You know, it's definitely not child protection, gender-based violence protection in general. These are not the big sectors, right? And these government counterparts, they have conversations with all sorts of private sector and foundations and international financial institutions and all these. And so when you show up and you say, look at Primero, it's great, it's in 100 countries and it's really, really good. And they say, well, why would I do that if I could do that one over there? And you say, well, let's compare. We can do all of these things, and Primero is really great at doing these things. But then they say to you, yeah, but this system over here can do other things. And so we get into these conversations that are very often about, do we have to pick between this one or this one? We know that maybe that's not the best approach, right? Maybe the best approach is taking the best of both of those things, understanding where they have to meet in the middle and where there's a necessity for them to integrate, and focusing our attention on that. Yeah. And so this either or dilemma is something we've faced for many, many years, but I believe in this statement that no single system can do all of these things. And if somebody tells you that their system can do that, for the most part, I don't trust that. Yeah. It always makes sense. It doesn't always make sense to build something, right, when you can connect to something that's already working. So the second dilemma that we often hear about is the partnership dilemma, right? If my organization has a system that we've invested in for many, many years, and we have a whole, user base that knows how that system works, they're comfortable with it, they're not demanding a change in that system, right? But there's something that we need to be able to do that that system currently can't do. This is a problem because very often you're going to be faced with a pushback in that situation. So in those cases, integrations can make a lot of sense. Instead of saying, hey, we want you to stop using what you're accustomed to and use our thing because it can do those things that you need, why don't we look at ways to connect our system so that you can continue using it for where it's adding value, and we can add additional value. The final one is the financial dilemma, and I would love to write a thesis on this, but I don't have the time to do it. But our experience with integrations is that they are not very expensive. And this might surprise everybody. It's a techie thing. The most expensive part about it is the human investment in it, the thinking, the designing, the workshopping, the human-centered design part, the engagement with users. That's the heavy lift. The actual part where systems have to engage and be configured to speak to each other, that is not the expensive part. And very often, financially speaking, integrations are cheaper than how much we have to pay people to do the same thing, and definitely cheaper than us building entire new systems in order to meet some requirement or functional demand. So these are the dilemmas that we often face. I want to give some examples of successful integrations, and these very, we have to be honest about, objective about how successful these have been. In truth, they functionally work. They provide value. Do they provide the value that we expected? Maybe, maybe not. The first example is the Primero Progress V4 engagement. So this is where Primero CPIMS Plus and UNHCR's refugee registration system Progress share information about very, very specific referrals. It works. The information gets exchanged. The question is, did we identify the right use case in the right place that was going to add value for the maximum number of users? And I think the consensus on that is no. We were able to, through lots of work and engagement, we were able to establish this integration. How much value did we add? I think our lesson learned on it is we could have done better there. We have the Oscar platform in Cambodia, which is being used by more than, I think, 40 organizations to manage information about children in residential care. And Primero came into that space. The government was like, we want to get rid of this Oscar thing and replace it all with Primero. Obviously, those 40 organizations are like, that's hugely disruptive to us. We don't want to do that. So what's the alternative? If we go back to our dilemma statement, the alternative was either or. No, we can do both of those things. The government runs and relies on Primero. It's a hugely successful implementation. And where we need to sync and exchange data with Oscar, that's been set up through an integration. And these links are available. The same thing with the ONA, which is a visualization tool, and the Ministry of Health in Thailand. These are all different examples. So what I would like to talk about now is what's needed to make these things work. And now we have an actual, I don't know that I would call it like a recipe for success, but a lot more understanding about what's required up front for an integration to add value. And I think we can package this and we can make this much more accessible to a greater number of people so that when you're out there working in the field and you're out there working with your partners and your ears are tuned into their experience and what their day-to-day is like, you can actually identify that thing, that process that they just said, that's something that we could solve with an integration. That little bottleneck, that little complication, those are the kinds of things that we need feedback from you so that we can identify where we want to do these types of interventions. So that first point is about solid user-driven use cases. What are people complaining about? What thing do they have to do over and over again that they hate doing because it's time wasting, duplicative, they're frustrated by it, they'd rather be doing something else. What are those things? Very often, those are the ones that can be unpacked by a clever business analyst like Janani and identify exactly what is the problem statement here. The second is an evidence-based assessment. So I really want to see people start to think about what our decisions in terms of units of measurement. How much time saved? How much improvement over our standard are we achieving through that change? Our conversation that we just had about user experience in the forms, it's very, very easy to stand over the shoulder of a caseworker and time how long it takes them to do a registration. If they're transcribing from paper to a digital form, if they're filling out an assessment on their phone, it's not a hard thing to do to say, do you mind if I record that, if I understand what your experience is? And if it took them 2 minutes and 30 seconds to fill out the form, and then you look at that form and you realize, there's a bunch of content there that maybe isn't necessary. Maybe we can simplify that form. We can put some skip logic in it and we can reduce that from, 20 minutes to 5 minutes. Those are the types of things that we need to look at. We need to have baselines and we need to be able to say, after we've done that work, that we have made this much of a difference. The third part is the shared vision between partners and implementers. I wanted to call this out because under all of this work that we do, and there's always currents between different organizations, there is the me versus you organizational feeling. Not direct competition, but definitely like, what's your organization is yours and what's mine is mine, and we're different and we can't. Integrations are about cooperation. Underneath all of that, it's about there's a difference in approach here, right? Between you do your thing, I'll do my thing, and we can both do our things better together if we do it like this, right? So that shared vision is really, really important. And I think we need to spend a little bit more time unpacking that. You need to have some resources to set this thing up and to maintain it. You need to have a governance structure because if multiple organizations are depending on an integration and the administrator over here decides one day, oh, we're going to change our configuration, suddenly that can fall apart. You've essentially pulled that critical that layer out and the bridge falls, the bridge collapses. So any changes need to be managed. They need to be communicated with time for the other side to understand the implications, test those implications. That requires good governance. We need to be talking to end users. We don't just implement this and put it out into the world and expect great results. We need to be fine-tuning. This is what I liked about Brandon's presentation from the PCM IMS. Because it's so young and so new, they're still constantly fine-tuning it. We should all be doing that. We should constantly be talking to users and fine-tuning as these implementations evolve and grow. And then finally, we've talked a lot about common data sets or semantic layers. This is apples and oranges. Apples and oranges are both examples of fruit. right? So I wanted to use that example in particular because maybe in your system, you're interested in fruit. And over here, we're interested in apples and oranges. There's a difference between having the exact same data set, as in my data and your data match perfectly. The formatting of the data is the same. In Jan's example and Jack's example in their UX, those are the questions that we're raising. Our systems are smarter than that now. We can create semantic layers that can say, well, you know what? I know what you mean when you say that, even if I say it a different way. And I want to explore that a little bit as well. So starting with defining problems. So I'm just going to throw these ones out here. I invented them myself, I admit, but most of the time when I'm using an example like this, I am drawing from my experience, and that usually is directly from people like yourselves. So these are a few problems that we hear about all the time with Primero. This first example is, as somebody who's managing a program, who is responsible for perhaps the way many different people interact with Primero, they would like a way to manage in a structured and safe way feedback about their services. How do we receive that feedback normally? Like, how do you receive that if you think about the implementations that you work with now? Somebody usually says it to you. Oh, maybe they'll write it down. Maybe they'll send a message. You know, I think the problem that we're often faced with is that we don't actually give our clients an opportunity to talk about the services that we're providing them. And in any other kind of service or industry, that would be fatal. That would be the end of your service. That would be the end of your business. If you didn't listen to your customers or your clients. And yet that's almost commonplace for us. I think that's something that needs to change. And so there's a problem statement. How do we do that? Another one, we do a lot of work with monitoring. So not the case management side so much, but is there a bad thing happening somewhere? And we all know that in protection, the gold standard is prevention. What we're aiming for is to understand situations well enough that we can prevent bad things from happening to people. Very, very hard to do if we don't have an open-ended, community-facing way to collect information about things that are happening. Because essentially what we're doing is we're waiting for the thing to happen, and then we're finding out about it. So this is something that I think is really, really important and has tremendous potential for us, not only as Primero implementers, but generally in humanitarian and development work. Another example is I want a way to just alert somebody that I trust, or an institution that I trust, about some type of child protection or a community-based thing, similar to the previous one. The fourth one I listed is, as a caseworker, I want to give my clients options to share their opinions with my organization. So maybe not about me, maybe about me, but basically imagine your organization is providing 3 types of services. And after months and months and months of providing those services, you realize that fewer and fewer people seem to want one of those services, and they're demanding a different service. And you say to your boss, well, why do we keep providing this service when nobody really wants it anymore? Why don't we do this? And your boss says, well, I don't see any proof of that. It would be nice to have something that was more dynamic and something that was more reliable, that allowed clients to tell their organizations that are supporting them what they really need. So I just threw those examples out there. I am trying to rush a little bit through this because I do want to have enough time to do a bit of a demo here with you. So our friend Pedro took time out of his day to show us about Unicare. And Unicare is a very interesting example of all of these things that I just spoke to you about previously, about the logic of integrations. Because when the idea of Unicare came up, it came with the idea like, let's build a new thing called Unicare. Well, what does Unicare need to do? Case management, incident monitoring, role-based access, all things that Primero could do, right? But it also needs to do these other things. And these are the problem statements or user stories that they had associated with that. So well, wouldn't it make more sense then that we would build this functionality, to integrate with what we already have? So what we developed here, what UNICEF developed, is basically in Keto. It's like an ODK form. It's basically like a UNICEF-hosted version of Kobo, and it's secured and managed. So we are confident that the data is not out there, and that we can speak, we can be confident that that data is in a safe and controlled environment. And the use case here is very, very clear. Non-credentialed users, so somebody that doesn't have to log in, it doesn't have to give you, their name and their details and have a session, can submit structured data on specific issues. And these forms are just as configurable as Primero forms are. And it has a bunch of functionality that's quite interesting and useful, including the ability to put a QR code somewhere. So something quite convenient for people. You can make a poster that says, how did you feel about the service you received today? And they could scan that and they could submit information in a structured way that would then, through an integration, end up in a Primero form. What kind of form and how those forms look, that's a separate conversation. But what I would like to do is give everybody the opportunity, if you've got a phone in front of you or a device in front of you that can scan this code, to just give it a try. And let's not make comments about the form or the content of the form itself, but because these forms are specific for the Unicare use case. But at least you could get an idea of how this functionality, this integration may be useful for unblocking complex problems that you see in your implementations. Yeah, that may be a better solution than something else. So you'll see, if you do check in here, that there's a preamble that talks about consent and the purpose of this data collection and how the data will be managed. It can be provided in any language that you need, and the data could be mapped to Primero. So it's meant to be as user-friendly as possible. It's got geolocation if you need that. Again, that's not required. And it's going to ask you, where you're from and what type of feedback it was that you want to submit. And it'll take you through a workflow that allows you to, there's skip logic on the form. And I would suggest that this is a fairly complex intake channel. This could be vastly simplified for our reasons. You can add your language. You can add personal information if you want, their age range of the user, etc. Did the type of feedback. And in this case, I'm going to say, does the issue require collecting personal data for follow-up? I'm going to say no, because I don't want to provide that information. And I'm going to add a few other data points here. And then what immediate actions would you like? And I'm going to say test for Primero. And then there's the option to add a document. And so I very quickly have submitted this form. And now I'm going to stop sharing for a second so I can see the screen. I'm going to ask if anybody has been able to submit a inform record. Okay, Awan, is that you confirming or is that you asking a question? Confirming. Look at that. Look at the use of those clever Teams tools. Anyone else? Awan, would you like to ask a question? Or was that a high five?
We
Okay.
got 2 submissions.
2? Okay. Are you on the Primero side of it, Jen?
Yeah.
Okay. So I'm going to, would you want to share your screen then?
Yeah, happy to.
All right. Let's see what it looks like when this data comes in Primero. So everybody's going to, prompt this is going to prompt some questions. It's like, well, normally in Primero, if I create and save a record, that record is associated with me as a record owner. What does it look like when some person whose identity is not validated or authenticated submits data to Primero? Obviously, this introduces a new complexity because we need to be able to assess if that data is of good quality, if it's real. It could be spam. It could be the same person submitting the form multiple times because they're exploring the form and they're not sure that they want to do this or not. So maybe they're kind of testing to see what information and how well this thing is going to work. Let's just understand that the data quality in a submission like this can be very good or it can be very poor. And so what we have here is a different type of triaging and processing for this information. So this is, again, specific for Unicare. But now you'll see here that this ticket has been submitted. It is in the language and with the information that's associated with it here. And it's come into Primero and been assigned to a triage user, to an intake monitor. Jan, could you show the record information? So here you're going to see that this caseworker code is a generic caseworker code for all of the traffic that comes from this particular channel. And then based on your own procedures for your organization or whatever, you would configure this and you would say, all right, based on the information I see in this record, I'm going to hit the edit button and I'm going to do a bit of my own review and assessment. I'm going to say, okay, based on this information, the feedback urgency is urgent. The sensitivity is, let's say it's sensitive, right? And then I'm going to say, based on this information that I have, Jan, you can fill out a couple things. Based on the information that I have, I'm going to save this record. And I'm going to relay this now to the appropriate person in my organization or the appropriate partner. So I'm going to hit the assign button. I'm going to hit the recipient. I'm going to say, based on the information that's been provided here, this meets the eligibility criteria to be assigned to this focal point or to this group. And I would do that in my system, add some information, and there we've just developed a feedback channel for an open-ended community feedback. So what use can this have in the Primero context? Well, we have functionality that didn't exist before. We could use this with parasocial workers, for example, people that don't have a login for Primero, but should and could add a lot of value to the work that social service workforce is doing. People that, for example, work with specific communities, community leaders, people that work across other sectors who don't actually do case management themselves, but they have contact with communities. But lots and lots of ideas, lots of potential use cases here. And of course, we're committed to, managing and it's not technology for the sake of technology. It's really about improving our reach and meeting requirements and creating that fabric of integration across partners and users. So this is free for you to tinker around with and play with and think about. The real takeaway that I want, that I'm looking for from all of you as community members is, do you have these clear problem statements? Do you have clear use cases where things that are frustrating, things that are intractable problems could potentially be addressed through an integration? Unless I hear a bunch of questions on this one, I'm going to move on to the next one. I know we've been online a long time, so I'm sensitive to the fact that your eyes are probably getting tired. So the next one, this is a little different. We also saw this in Pedro's. Presentation, but I want to give you the chance to use this as well. Rapid Pro is an incredibly powerful tool. It's a messaging app, but it works with a whole variety of different messaging apps: SMS, Viber, Telegram, WhatsApp, Facebook Messenger. These channels have different characteristics and can be used for different things, but what's consistent across them is the ability for us to manage workflows without having to add code. So without having to pay developers to develop these structured conversations that we can have using chatbots. And I'm very impressed with how user-friendly the chatbots have become. it used to feel like it was a very hit or miss kind of thing. But, if we want, for example, to target frontline workers with capacity building initiatives, this is a very, very useful tool. You could very quickly and easily create a conversation, a workflow, a chat flow that says, hey, remember the training we did last month? Have you been able to use that skill set? Yes. Answer 1 if yes. Answer 2 if no. If it's no, why not? Is there something we can help you with? Boom, bang. And in a few minutes, potentially address an intractable problem that's faced your organization in its attempts to scale up, in its attempts to reach those last mile communities. Now, these are really, really important tools. They're being used very comprehensively across other sectors, and I'd love to see some solid use cases with a responsible implementation strategy for us. So I'm going to show you an example here of how this works for Unicare and using WhatsApp. I'm not going to share my screen like Pedro when he shares his personal WhatsApp on the screen. I would be too afraid to do that. But you can see here, very quickly, it pops up on my screen. It says, welcome to Unicare. This message, send this to start your chat. And as soon as I start the chat, I'm basically going down a path where my decisions will determine what the next question is, what the next question what kind of support I'm going to receive. I can back out of this at any time. I don't have to add any identifiable information, and I can be very specific about my requests and what I would like. So I'm going to say that I'm between the ages of 15 and 17. Of course, a lot of adolescents use devices and use technology, and I think that's the other thing that we often miss out on, is that if given the opportunity to engage directly, I think a lot more people in the communities where we work would do that. But I think we're very technology shy about that, and for good reason. So then I'm going to say, that I'm a male, and my next question is going to be prompted after that. And you can just see it's a very, very straightforward workflow. It's going to ask me where I'm from. All very, very simple, very structured data. So the user experience is very straightforward, very easy to manage. And at any given time, it's all very developed with a rights-based approach. And I'm going to say, for example, I'm going to make a request for assistance. You can see it's a pick list. Doesn't require me to spell anything. It's just buttons. Buttons, pick a number. There's a very clever little menu, so you don't accidentally share information that you don't intend to. And then there's open text fields when you want to submit text. I'm going to say I need a new voucher, and it's going to direct that. It's going to give me options. If it's a high risk situation, it's going to tell me where I should immediately go, or where, if it's going to refer me to another service. It talks about my data protection and data subject rights, and all of this information very, very quickly collected. I'm going to submit this one, but I think everybody understood from the previous one, it's not a complete case management process. This is used for capacity building, community feedback, gathering feedback from service providers themselves, gathering feedback from the clients we're serving. And all of these can be configured to be extremely simple and straightforward, available in local languages. So quite a powerful potential integration for us. And we'll leave you with this slide so that you can play around with the QR code in the WhatsApp channel. I'll stop sharing there for a minute to see if there's any questions or feedback on that. I don't see anything in the chat. And Simone is warning me that I'm running out of time. Very good Very
have a
good
question, though.
facilitation.
Khulud. We have a question from Khulud. Khulud, go ahead.
Oh, I just need to allow her mic.
No,
One.
I should have done that. Khulud, you should be able to.
Yeah, thank you. Thank you, Robert and the team. I think this is really helpful and useful because actually this is what we have done outside the system using the feedback, and we had like a satisfaction survey for our beneficiaries using our services, and we did it on Kobo. And we're planning to have it like we did it last year and this year. So, and we're planning to have it like on annual basis. And I think having it now as part of the feedback mechanism and that can be linked, I think will be really useful and helpful. So this is what I wanted to say. Thank you very much.
Great. Keep sharing ideas. We want to be discerning about where we choose to use tools like this, but in some places this gives us capabilities that we didn't previously have. So appreciate your validation of that idea, Khulud. I know that where you work, for example, that is probably incredibly important to have regular feedback and the opportunity for people to tell you, what they need, what's working. Did anybody else have thoughts on the chatbot? One thing I wanted to ask is, we're working with WhatsApp in this particular implementation, but in many parts of the world, WhatsApp is not, let's say, a preferred messaging technology. So what other messaging technologies might be useful, and what populations use those messaging apps? For example, I don't know very many people that use Facebook Messenger where I live. In some places, that is the most common messaging app. So, the ability to work across these different messaging platforms, I think, is really important. It's a single tool, a single integration that allows us a whole range of opportunities and benefits. Okay, I don't see any hands coming up on that. I just have one more thing to share. This is the login for the Unicare. Jan already logged in and shared that with us. So this is my question and my request to all of you. And this is where the community is just really indispensable for us. So I'm listing a few of the problems that we want to solve that we hear about all the time. Right? But we really want this information to come from you. So types of problems we want to solve: repetitive, manual transactions, things that caseworkers shake their head at and dread, and they have to spend a lot of time doing because those processes have not been streamlined. Duplicative work, like creating multiple reports, right? So you need to do one style or format of report for this donor or partner or government or whatnot, and then just a completely different type of format for a different partner, but double the work, right? Overdependence on a single individual or role, which creates bottleneck. This is another one that's really important because it's bad for that person, the one who's the bottleneck, and it's bad for others. So when we see a business process that is not efficient, we should, with good faith and courage, look and try to understand why that's happening and see what we can do, and see if an automation or an integration or even just a process simplification can help address a bottleneck. And then the fourth one I listed was steps in the process that are just too difficult, so people skip them or they just enter poor data. So this has been the case in the past with, for example, family tracing unification, that well-intentioned and very, very experienced people include a lot of data in a form. so that that data can be used to reunify. But that often led to situations where either the steps in the process are completely skipped because they're too onerous, or they're just incorrectly completed because they're too complicated. So these are some examples of the types of problems that we would like to solve in a future state where we're working better, we're working more efficiently, we have more integrated systems, and this is the future state. So with that, I think that was all I was going to share. I will hand back to you, Simone, to see if there's any other follow-up.
I have included a few from Pavel and from Awan that were raised earlier. I put them in our whiteboard. I think one is around adopting minimal effective scope mindset, so launching smaller but high value enhancement, especially when it comes to integration. And then a second one related to always measuring frequency times impact when it comes to potential new initiatives related to integration. So these were like thoughtful ideas I thought we could carry on in 2026. Do we have other ideas from the group? You can put them in the chat. I can basically, or include them directly in the whiteboard.
I really like that validation point that Awan made.
Yes, I will include that.
And Lama's point there is about performance.
Yeah.
Okay. Well, we're collecting some inputs and ideas on this, but I hope everybody, take some time to think about this. And, we're in a position right now where I don't think it makes sense for us to do any more integrations unless we've got those prerequisites for success well established. So we're very convinced about the transformative potential of integrations, but we've learned our lesson about doing them without doing the sort of proper prerequisite work. So I'll close the session on integrations there, if that's okay.
Yes. And we move to our last session on planning. So what's for 2026? I hand back over to Jan to guide us through.
I am unprepared to guide us through, but I will bring up the whiteboard actually. So one of the things that we typically do is we just want to walk through what's been shared in the feedback, make sure we're really clear in what you are sharing back with us. Sorry, and it's just loading on my side.
I can share it from my end, Jen.
Oh, perfect. That's great.
Because I have it all.
Amazing. So what I'm going to do is walk through kind of post-it by post-it just to make sure we're really clear on our side. I'm hoping otherwise people can also add themselves directly into the whiteboard. So I'm also going to just paste this into the chat as well. I was typing a message just to say to Lama Samia, I think one of the key things that we've been working on in the last 6 months is to improve our performance and do a lot of optimizations. But I'm going to check in with you to see how we can also further improve these in 2026, especially because we want to make sure that that's not an issue. So retrospective. So what we're looking at here is what we learned from this year, what didn't go well, what do we want to prioritize, and just other random ideas that may or may not have been fitting into any of these categories. So Simona, if I could ask you to just zoom in on the what did you learn this year, that would be greatly appreciated, if it's possible. Perfect. So we got some feedback on learnings were integrations between national and global systems. So having that alignment and policy approval, I think that was something that was really exciting to see, is how the Indonesia team was able to build on to Primero, kind of it created a life of its own and have these national systems actually integrate. So really exciting that we have that knowledge base. And I remember, I think from Mamadou's Liberia presentation, we had talked about having a 2-pager created to really highlight when these types of implementations happen to help others. So I've already put that down as a separate post-it, which is going to be a follow-up to that. The next one was building an API interoperability that is not only a technical task, but also a governance process involving data standards, access rights, and protection protocols. Finally said, whoever wrote this point. I think, interoperability, as Robert had just walked through, is not about just the technology, but making sure everything around it works. You'll hear this, I feel like a broken record when people talk to me. Right now, we're working on GBV and CP interoperability, and the reason why it has been so difficult is because the programmatic guidance doesn't exist, or there's nothing that's been standardized, and so it's really hard for the technology to meet what the global guidance and the processes should be according to those standards. And so I think that's something that we need to continually work towards in this community, in defining those various aspects. Strong coordination. And also, if I'm interpreting your post-it incorrectly, please interrupt or put your hand up, because I'm very happy to stop and clarify. The next one is strong coordination with Data and Information Bureau. The MOWECP service units accelerates ownership. MOWECP, I can't remember which country this is operating in. Rob, I'm wondering if you do, but I think essentially it's going to be, again, more ownership on governments being able to hand over, having those service units actually take over this ownership. I've referenced Dion a couple times. The Trinidad team in Eastern Caribbean is another example of this, which has been fantastic. The Pakistan team and UNICEF had led this with the Ministry of Social Affairs.
That's
So you've seen a lot of great, and that was Indonesia. Okay. So lots of great examples where ownership is not just on the UNICEF or UN team or INGO team. It's handed over to where that mandate is should be led by. Then we have continuous capacity building at national, subnational levels is critical for sustainable adoption. I think you all know just how incredibly important you are to this community, but I think the capacity building and in your availability to all of the different people you're working with on the ground to help train them, to improve their capacity, to relay the feedback back to us, to help us build better tools. That's really something that has been nice over the last year. I think we've come a long way since our annual meeting in 2022. The product has had a bit of a facelift with the new version being launched, the new offline application and everything. So yes, it's been a really exciting, continuous year of learning, I think, on all fronts. The climate marker has been super useful and innovative, and we need to scale it up. Definitely. That was huge. I think I've never felt so remotivated when you there's so many things going on in the world, and that just seems like such an easy thing that we can implement in all sites from a caseworker and training perspective, and it's going to have so much value. The GBV IMS Plus is making great progress, and we need to invest more into it and sustain it. That is, I think, as Laurent had presented in the changing of the protection cluster and the lack of a better word, the shutting down of the CP and GBV EORs, this is exactly it. There's a huge risk with the GBV IMS Plus, and it's such an important tool, but also the framework around GBV and the processes need to be sustained. And this is something that we will obviously continually be behind, but it needs to be programs that drive this. The next one is from Shaquille. So recognizing the need of establishing a central dashboard that consolidates data from multiple deployments for decision making. They want to focus more on aligning this to their various stakeholders. I think that's something that we've been very mindful of, is ensuring that we have APIs, which are endpoints that we're able to connect to visualize this information. So if Primero isn't able to give you the dashboarding visualizations that you need, pulling them into Power BI, and I'll pop in the chat the data challenge work stream where you can get that documentation, or you can come to the Primero team to help you in building your dashboards. So more on the climate markers, internal referrals have been improved. That's great to hear from Aminu. This is from the Nigeria implementation, our largest implementation. So hearing that their internal referrals for coordination, I think they have almost 6,000 caseworkers or 8,000 caseworkers nationally using the system. So really exciting to see that. Primero can be found in different shapes. From case management platforms to profiling tools to gathering tools to etc. All these different digital products, and that's from Ali. Yes, it's been really exciting to see that this product has evolved from just being this tool for only child protection, and then into these various use cases that you've seen over the last day and a half. It's really nice to see the child functioning module pilot and the success of that from Suman yesterday, and hearing all of the country updates and experiences and partnerships. I think for me personally, that's always my favorite part of any global meeting, is sitting and listening to all of the different implementations and programs, and you see how everybody is using the tools globally. Yesterday we had almost 120 participants for the full duration of our 5-hour annual meeting for virtual day one, and now today we had, I think, at a maximum around 70 or 90 at some point. So it's just really great to see that we have so many people using this tool and coming together in this community. So what can we work on, and what's missing, or what are the gaps? So that's what we're looking at next. Just sorry.
Do you want to tag team this, Jan, or you want to keep moving?
No.
All right, I'll do this one, and then we'll get somebody to do the next one, and then we'll get somebody else to do the next one, just to give you a break. So, Simone, why don't you take the pink one? Or who else is in there? You seem to be there. You take the
Yes. So in terms of what was missing, we have an input from Nigeria about the usage report that has not been working, along with other reports like protection concerns and summaries. There is also interoperability between CPUIMS and GBVIMS, which is still not there. And there is inputs about and more emphasis on the importance of interoperability between these two systems. I will raise the one first related to Primero, and then we'll move to the one related to the meeting itself. There is one on performance work and optimization. So there are some challenges in relation to accessing the system, sometimes, especially at the end of the month, where there is heavy reporting and heavy exports that is being made. So this is an issue that some users have been facing. And I think that's it for Primero. Otherwise, when it comes to the meeting, we faced some issues with the voting because a person could vote multiple times, which didn't accurately reflect the people or the group opinion on the presentations and what was like a good initiative. In-person meetings, of course, are way better. I think for online and for the future, maybe we can have a bit more breaks instead of one every 3 hours, to have one every half hour, every 1 hour and a half or 2 hours, to include real-time translation and the access to the whiteboard to make sure that we have a whiteboard or other mechanism to input information that are accessible outside UNICEF. So that's for the pink. Let's move to the next.
Just before you move to the next, I just wanted to
Yeah.
say this is really cool to see this. I know we've only done one virtual prior to this, and otherwise, yeah, it's been in person. And I know a lot of the names in the group, you guys may have not actually attended in person. But normally we have Post-its, and all of the team members are running around with Post-its of different colors. So seeing it come together and in such a way where it's already kind of organized and consolidated like this is just really, really exciting to see. Just wanted to add.
Yeah.
If I can kick back over what do we want to prioritize in 2026? So more work on climate. How do we take this to scale? Great question. I think that's something that we need to prioritize. And I guess before I go into what we want to prioritize, the team is going to take all of this back and figure out a work plan around all of these items. So this isn't something that is just forgotten. This is what defines our work plan. So we will come back to you through the regional focal points myself to see how do we take these things to scale. So the next one is expanding Primero cross-border, especially in the case of returning refugees. Huge priority for us. I think this is coming up in so many places. It's always been super difficult, but I think definitely has to be on our priorities list given everything that's been happening in globally. Humanitarian markers to account for the impact of wars and man-made crisis on protection of children. Well, that's exactly it. How do we incorporate those markers? More interoperability, CPGBV, and social protection is on the list most definitely, and it's in the queue that we're working with all of the various steering committees. More AI, definitely. Consider how to best contribute Primero analytics to disaster climate forecast, vulnerability risk mapping, and in turn use some future risks modeling to inform case management and target investment through high-risk communities. Proactive and preventative approach, definitely. I think that's really well said. And I think that kind of relates back to the markers and the climate scales. Lots on the climate markers, interoperability we talked about, cross-border interoperability, Unicare flow needs to be strengthened to handle self-registered cases. Definitely, I think that's something that, especially since that's just a new pilot, we need to look at how we can refine those flows. Finding a solution for a huge caseload connection with Power BI or let us go for a fresh instance. Yeah, I think we actually just found a solution for this. So I'll connect and with all of the admins to share our very good news that we are able to now connect with a large caseload and for single identity provider sites. So we'll come back to you, Aminu, on that one. I think global effort to review and refine configuration, that's our huge priority for 2026. It's making sure these configs are aligned to the features and functionality and way more simplified if we can. Adopting a minimum effective scope mindset, launch smaller, high-value enhancements early, test and iterate. Ooh, it's like straight from a developer's mouth, but it's Simone. So that's a great feedback. We definitely need to iterate and continue to develop with just minimum viable product. And I think that's something that is why we've been as successful as we are and need to continue to do that. One area that can be very important is not always something in the deployments. I see in the deployments is data validation, validating the format of a national ID and phone number. This is actually a really good point. And I think something that we need to come back to together as a team to understand how we do better validations, not just for phone numbers and IDs, but like, I think any type of text that has this type of a format. And then if you're able to just slightly scroll down, I think there's a couple more that are on the bottom row, or maybe just one more. Look into the performance. So that's exactly it. So that was the one that came in the chat. Yes, and give Primero a new visual refresh. I think that was something that we've been talking about on the Primero team for a while, is just giving it another facelift and keeping that UI fresh. So this is really exciting. It's nice to see all of these things are actually on our radar too, and just a matter of how we prioritize in 2026. So I might hand
So I
back.
can, yeah, we'll move onward with the other ideas we have on our chart. So initiating short documentaries to be shared within the periodic newsletter on how Primero solve some issues, so some good stories made into maybe short videos. This is an interesting idea to be also more vocal and visible with what we're doing and how we're changing things around. Upskilling for caseworkers, introducing some key program areas as a separate module for CPIMS, like harmful practices related to FGM and DCM, justice for children and children with disabilities. So the children with disability one we have covered, but maybe for the other aspect also guidelines in relation to those. Education sector is coming forward to adopt the system for tracking. That would be great. Tracking retention, why not? Working with CPIMS in schools. We had some ideas around that for the United Arab Emirates. Didn't move much forward, but any new context with education would be welcomed. If we do a two-pager, let's put them on Support Hub, so possibly, I'm not sure it's relating to what exactly, but yeah, indeed, I think for any new guidelines to have them on the Support Hub and to have the AI integration on Support Hub would make things more easy to find. We need an impact evaluation. Yes, Robert? That's a big one. And we need to develop a two-pager for Liberia for the two-ministry use case for case management and justice for children. We need to continue to apply frequency times impact, especially when it comes to integration and other initiatives. Develop a checklist for configuration health checks. That's very important. And then finally, a user feedback loop for the Primero Academy. Sorry, we have still one more. What other documents do we have that would benefit from the AI for translation? So that's also something we need to consider and include. Did we receive anything additional in the chat that I need to add?
No, just I thought it was really interesting. Abdi raised CPIMS for children formerly associated with armed groups. And this is something that, we definitely have features and functionality that support this. I think it's just a matter of how we integrate. I'm not sure which implementation you're a part of, Abdi, but that is something that is something we can do just based on the coordination you have in country. So that was about it. I think there's nothing else in the chat that was additional.
Will the table stay open for a while, Robert, for people that would wish to add maybe something after the training?
That is the plan. I wish I had understood earlier that it was such a limited to UNICEF thing, my Miro board subscription expired and I didn't renew it. So we could have used a Miro board, but that's my lesson learned from all of this. And I'm going to ask a favor because I know it gets to the end and people will start dropping off. We already dropped down under 50, but I don't get to eat unless I get a survey for the meeting. So before you leave, it takes exactly like 3 minutes to complete a survey, and it will be important. So we don't wait till the very end to ask people to complete that. Make sure that everybody can open it, please. Okay. I think this is pretty rich, and we've managed to collect quite a few inputs, even if I think 20% of them are mine. So I'm going to ask everybody to spend the next few minutes on the survey. I think we're all growing weary of the long virtual meeting, but I'm very happy with the turnout and with the participation. The presentations were outstanding. While you're filling in your survey for us, please, I'm going to share with you the link to the microsite again that already has the recording from yesterday uploaded. So you'll see this is how we will be publishing the materials from today as well. It takes us a little time to, sort it out and curate it and make it look nice, but this site in, the next couple of days will have all the material that we need there. That will have, it's too bad it won't have a whole section on the photographs of the event and us spending time together, but this is the year we're having. And I'd encourage you to share this with your communities, with your partners. It's important stuff. There's a real ton of good content here. Yeah, and let's just check. I'm going to look at my survey form, and I'm not going to let anybody leave until we're satisfied that at least some of these responses are coming in. Not enough. We need more. Not enough. We need more. You're not free to go yet. Still have 44 people online. Come on, Jan, Simon, pitch in,
I'm done with, I've submitted
convince
mine.
people to convince people to share their.
Yes, it's exactly.
It
Sorry.
takes
I was putting
exactly
it in the
2
chat.
minutes, so please do it.
I'm going to tell Jan that she's not allowed to help anybody else that unless they've submitted the survey for the next month. No, no direct support from Jan if you haven't submitted your survey.
Well, that's exactly it. I won't respond, which is the hardest problem I have. No, but really, I just wanted to say this feedback helps us do better. We do this every year, and it makes it so we can be better every year. So it's really, really valuable. It's not just something that's disregarded. And we put it into our considerations as we plan this. The team has put a huge amount of effort over the last several months getting these last 2 days prepared for you. And so we do hope that you had as much fun as we did, kicking off the end of 2025 together. And I just want to give a huge shout out to Robert, who led this whole process through this annual meeting. He's such a fantastic presenter. I'm sure you guys all feel the same way, and such a fantastic group of regional focal points supporting all of you. And we want to keep doing this year after year and make sure that we're meeting the needs of the community. So this is my pitch for you to fill out this survey. so we can continue to do this for you next year. And hopefully next year we can actually have it in person. Would love to see all of your faces and be able to take you all out for dinner after our last day, but it just is the international world of development is just not the way that it was, unfortunately, but we will take you all out one day, I hope, in the future. So Rob, tell me, how many survey responses did we get?
Not enough.
No.
No, it's getting better. It's getting better, but that makes me think that, there's still a few hangers on here that, this community's got more in it than the number I'm seeing. Let's just say until I am satisfied that, half of the people on this call right now have responded, I'm just going to stand here listening. 5 more minutes.
Gosh, I wish it was happy hour. It's 9 o'clock in the morning for me.
Yeah, Jan's got a whole day ahead of her. Okay, everybody. I've
Yeah.
made you struggle enough. Although I think there's probably still a couple more out there. We're going to leave this open for the rest of the day. Just remember, Jan doesn't get her paycheck unless we get at least 25 of these. So, sorry, Jan. Looks like it's going to be a tough month for you.
It's a hard month.
We can send also an email, maybe with a link, Robert, to all the participants.
Yes, we will do that.
Definitely.
We will do
Yeah.
that. All right. Well, let's not linger too long here. I think everybody has done wonderfully, and we've heard from so many great and interesting colleagues. Nothing that about this meeting has made me think that we're in in a moment of crisis in this community. I think we're recognizing our value and the support that we have and the collaboration that we have. I couldn't feel more proud of what we've built here, and I just want to make sure that you all understand that you're part of a growing global community. We depend on each other, and please continue to do that. And I look forward to seeing you in person at the next Primero Global Meeting, maybe in Bahamas or Cancun. All right. Thanks, everybody. We'll let you get on
Thanks,
with your day.
Have a good
Appreciate
day.
it.
Have a good night.
Ciao,
Bye.
everyone.
Thank you.
Bye.
Thanks, Robert. Thanks, Jan.
Cheers, everyone. Bye-bye.